Hey there, mamas. Let's get real. Have you ever laughed, coughed, sneezed after having a baby and thought, ooh, what just happened? A little bit of urine came out. And you told yourself, maybe it's normal. I did just have a baby. Well, guess what? It is common, but definitely not normal. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. And in today's video, we're going to be discussing about stress urinary incontinence and why does it happen so commonly after pregnancy. If you're new to the channel, welcome. I hope you like what you see. Here we talk about everything pelvic health. Why does pelvic health issues happen and what can you do about it? So if you like what you see, don't forget to subscribe and share it with a friend. I assure you, you're going to find value. And remember, just because we talk about women's health doesn't mean you have to be a female to learn about these things. So let's start with what is stress urinary incontinence and why does it happen? So stress urinary incontinence is leakage of urine with laughing, coughing, sneezing, exercise, walking, any kind of exertion that puts a lot of pressure in your belly. It's not related to emotional stress. It's actually the physical stress of putting pressure in your abdomen because it increases the intra-abdominal pressure or the pressure in your abdomen, which can then in turn put more pressure on the bladder and the urethra, which, if not supported well, can lead to leakage. And if you are somebody who have just had a vaginal delivery or even a cesarean section, the process of laboring and the process of the baby coming out through your vaginal opening can also cause a lot of stretching, a lot of damage to the pelvic floor muscles, as well as nerve injury, which again can compromise how the bladder and the sphincter of the urethra, which is the pipe through which urine comes out, those things can be affected, thus leading to urinary leakage. So why does leakage of urine or stress incontinence happen more commonly in pregnancy as well as in the postpartum period? So during pregnancy, number one, as the baby grows, that puts a lot of pressure on your pelvic floor muscles, which over time can weaken your pelvic floor support. Number two, hormonal changes that happen during the body during pregnancy can also soften the pelvic floor support as well as weaken the sphincter muscles. Also, as I mentioned before, during delivery, as the baby comes out through the vaginal opening, it can cause a lot of stretching of the pelvic floor muscles. It can also cause a lot of nerve injury to those muscles. Many women suffer from vaginal lacerations as well as something called an episiotomy, where your physician will make a surgical incision or a surgical cut in the vaginal opening to help deliver the baby easily and smoothly. So all these things can cause a lot of trauma to your pelvic floor and can cause weakening of those pelvic floor muscles. So imagine if this is my bladder, this is the urethra, as we've been talking about, the urethral support, which is usually provided by the pelvic floor muscles and the anterior vaginal wall, when it gets compromised can affect how tightly the urethra can close. There are also sphincter muscles around the urethra. So for example, if this is the wall of the urethra, there are muscles around it that helps close the urethra, and those can also be damaged. So those sphincter muscles, when damaged, the urethra just stays open, just like an open hose, and then urine can leak out as well. Let's take a few minutes to talk about some common myths when it comes to stress urinary incontinence. Number one, isn't a little bit of leakage of urine or stress urinary incontinence normal after pregnancy? Wrong. Normal is not the correct word. It is very common, meaning a lot of women will notice that they have stress urinary incontinence during pregnancy as well as in the postpartum period, but it's definitely not normal. Number two, Kegel exercises should cure your problems. Yes, Kegel exercises and any kind of pelvic floor physical therapy is helpful in improving your urinary symptoms, but I cannot tell you how many patients I see in my office who tell me that they've been doing Kegel exercises for years by watching videos on the internet and trying to do these things by themselves. And when I actually do an exam and ask them to do the Kegels, they're not even isolating the right muscles, which is why it's so important to make sure that if you're going to dedicate the time to do these exercises, that you do it correctly with the right guidance, with the right kind of support. So what are the treatment options for stress urinary incontinence? Let's start with the conservative treatment options, and then we'll discuss some of the surgical treatment options that we have. Conservatively, as mentioned, pelvic floor exercises, when done correctly, can be really beneficial. We have very good data that shows that good pelvic floor physical therapy over an extended period of time can improve your urinary symptoms by almost 50%. Now, anytime I say pelvic floor exercises, a lot of women think about Kegel exercises. And that is correct, but it's so important to make sure you're doing those Kegel exercises correctly. And if you're not sure whether or not you're doing them correctly, ask your doctor to give you a referral to see a pelvic floor physical therapist who is a physical therapist that have expertise in taking care of women with these kind of pelvic floor issues, and they can guide you, individualize the treatment so that you can get the most from your efforts. Another thing to remember about pelvic floor exercises is it does take time, just like any other muscles in the body. You don't go to the gym one day and expect six-pack abs the next day. It does take time, it does take patience. So keep at it, be consistent, be disciplined. At least 3 months of good, regular, properly executed pelvic floor PT and doing your Kegel exercises, you will notice improvement. Number 2 are pessaries. What are pessaries? I have many videos where I show you pictures, demonstrations of what a pessary is and how it works. But guess what? Pessaries are not just for prolapse. You can actually use pessaries even to treat stress urinary incontinence. Same idea, it's a vaginal insert made up of silicone that we insert into the vagina, and then for urinary incontinence, the pessaries are designed with a special kind of knob that can push against the urethra and support it and provide the support that the urethra lacks. Number 3, lifestyle modifications. Making sure you don't overdo on the hydration. Avoiding bladder irritants that can irritate the bladder and make you feel like you have to run to the bathroom all the time. Cutting down on caffeine or things that can irritate the bladder. Managing your constipation, managing chronic cough, reducing body weight, and all these lifestyle modifications can also help improve your urinary symptoms. And finally, minimally invasive surgical techniques. Minimally invasive means most of these procedures are done with tiny incisions and sometimes no incision at all. They're usually about 5 to 15 minutes. We do it with sedation. Patients go home the same day. There are things like sling procedures, urethral bulking injections, which are very safe and very easily done. And the success rates for the right patient can be amazing. In the comment section, if you want me to make a detailed video of all the surgical options that we have and all the different minimally invasive options, let me know in the comment section and I'll be happy to make a video that goes into more details about these procedures. So here's the million-dollar question. When should you seek help? If you're leaking urine and it's affecting your quality of life, you're wearing pads all the time, you're avoiding activities that you used to enjoy because of fear of staining your underwear, if you're embarrassed to be intimate with your partner, you're avoiding trips with your family and friends because you don't want to burden them, then yes, it's time to get help. As I mentioned so many times in this video, urinary incontinence is very common. You can have it in pregnancy, you can have it after, as well as during menopause and after, but it's never normal. And in today's day and age, there are so many amazing treatment options, as we discussed, that are very safe, minimally invasive, and the best part, the outcomes and how much and how significantly it can impact a patient's life is incredible. So please don't suffer. If you're being bothered by these symptoms, get the help, preferably see a urogynecologist who can talk to you about all these different options and individualized care based on your specific needs. I have seen thousands of women in my practice, both in the United States and worldwide, who have been suffering with stress urinary incontinence silently because they didn't even know that there is help. And I'm talking about not just my patient populations. I have women in my extended family, amongst my friends group, who are very well educated and still thinks this is a normal part of aging. Well, I'm here to tell you that is not correct. Let's change the narrative. If you're here watching this video, means you care about your health. So please share this video with all those around you, with all your loved ones, men, women, friends, family members, everyone. Let them know that this is a condition. Yes, it's common, but there's so much that we can do to help you from suffering from these conditions. If you liked what you see, don't forget to subscribe to my YouTube channel. Remember, pelvic health issues are real issues. There's no shame, there's no stigma, there's no taboo. This is a safe place where we discuss everything so that you can leave feeling empowered and knowing what are the next steps you need to do to take care of your pelvic health. So I'll see you again next week with another topic, another video. Till then, stay well, stay healthy, and don't forget to take care of your pelvic health. Bye!